I'm Angela. I've had chronic pain for 26 years.
This is a typical patient us OTs and PTs may see in clinic. She's broken a few ribs, has trigger finger on and off, occasional back discomfort, 17 shoulder dislocations, ankle injuries, and upper quadrant neck discomfort, which occasionally radiates up to her head and gives her headaches. If we look at this patient locally and treat a specific diagnosis, we are going to miss the mark. We must alternate between focusing locally and then looking globally. I'll show you how I do this in my treatments. So first, I'll perform a few pre-tests and make some general observations as to how they're moving, noticing what's moving, what's constricted, and what's moving too much prior to her lying down on the table. As we observe her gait, you could see a great deal of lumbar rotational movement with very little thoracic movement and extra arm swing to compensate. We could also observe a downward trajectory of force through her heels while her toes remained extended straight. This in turn sends the ground forces directly into her hips and low back, reinforcing the mild lumbar lordosis she already has. After setting her up in a position of comfort, I'll begin by focusing on her periscapular region with the intention to free it up. Once this occurs, my intention will shift to teach her brain the association between the scapula, the arm, the thoracic spine, and all the associated parts around the scapula. However, because this part of herself is so out of her awareness, I need to go extra slow so the brain can begin to make the neural connections. My touch is soft and gentle throughout the entire treatment. This very light touch gives the brain specific proprioceptive information as to where the body part is in space. And so once I clarify the scapula in her brain, I'm next going on to teach the body and the brain the associated relationships between the scapula and each specific rib and vertebra. And here I am supporting ever so softly under her cervical vertebra so that these muscles of her scalenes and her neck could soften and let go. And these muscles have been holding on and overworking for a very, very long time. Feldenkrais found repeatedly that when a body part is injured, its representation in the mental map becomes smaller or disappears. He relied on the work of Canadian neurosurgeon Penfield, who showed that the surface of the body is represented in the brain by a map. This map is known as a homunculus. We all have a motor and a sensory homunculus which work in tandem with one another. What that means is that when the sensory information is clarified, it then in return clarifies the motor information, and just the contrary is true as well. The size of each pictorial representation in the homunculus, or the brain map, is dependent upon the amount of motor and sensory stimuli it receives, specific to that part of the anatomy and not according to the body part size itself. One example of this is that for a baby, the thumb has a much larger representation in the cortical map than all the other parts of its body due to all the motor and sensory stimulation it receives. As we clarify the motor and sensory information in our brain maps, not only do our coordination patterns improve, but we also move, twist, and turn with more ease and more grace and freedom. Another key concept in Feldenkrais is called differentiation. As an example of this, you could see how I'm providing very specific information about the relationship between one specific rib and its associated transverse and spinous process. and then moving on to the next rib. And this will then in return clarify the differences in the brain between each rib and the associated parts. Eventually, the brain will learn that T4 and T5 can move independently from one another as opposed to moving as one. After differentiating several individual ribs and vertebra, I may then do a more global movement of moving the entire rib cage all together. And it's amazing how freed up the rib cage will become. People who have had long-standing pain or chronic pain will move through the world as if they were wearing a straitjacket. They'll be holding different parts of themselves as if it were one, as opposed to moving themselves more efficiently and segmentally. And I truly believe that most overuse injuries, arm injuries, carpal tunnel, and the like, are a result of a lack of connection between the arms and the back or the torso. Differentiating each individual part will make turning, twisting, bending, and reaching so much more coordinated and easy. My first decade of working as an occupational therapist, I very often used a great deal of force in my manual techniques. But years of experience has shown me that these sort of manual treatments are superficial and impact primarily the soft tissues and fascia. While this indeed can be helpful, I'm most interested in providing treatments that will evoke long-lasting change, especially since most of the postural habits we're talking about have been with the client for years. So many pain patients are in what's referred to as sympathetic upregulation, which puts the body into a prolonged fight or flight response. You must be in the parasympathetic state to decrease inflammation and to allow the muscles to rest and repair. No operation or procedure will have a positive outcome when the patient is sympathetically upregulated. As I treat, I am listening and assessing how the body wants to move. This, in addition to the slow, intentional touch, sends messages to the nervous system that it's okay and safe to let go. The vagal parasympathetic response is evoked, which allows the body to release the excessive co-contraction patterns. The method was created by a man named Moshe Feldenkrais, who suffered from a debilitating knee injury when playing soccer. The doctors told him only surgery would help him to recover and walk again. Yet he laid on the floor and retaught his bones, muscles, and entire nervous system how to function normally again. The method stems from his knowledge of neurology, child development, and his background as a physicist, as well as martial arts, as well as the study of the mind-body connection, focusing on how thoughts, beliefs, and feelings affect the way that we move and feel. Feldenkrais is not only used as a pain management modality, particularly for those clients who have been unsuccessful with conventional therapies, yet it's also used by high-level athletes and musicians, as well as anyone who wishes to feel more balanced, alive, and free.
Woo, look at you. Wow, feels strange. It's
a new identity. I know that's always a strange feeling.
Yeah.
Okay, and at your own time, you could come up and walk and stand.
Okay.